Step 23, FSH injections. In IVF, you use three different type of injections. One is stimulation injections, second is down regulation injection, third is the trigger injections. FSH is a stimulation injection. It's very important to know which one is a stimulation injection, which one is down regulation, which one is trigger injection. Okay, so these are the FSH injections: Gonalev, Bemfola, Ovalib, Follistim, Purigon, Ricavel, Elonva, Brinivel, Fertinex, and Fostimon, Pergoveris, and Menopur. If you are prescribed one of these drugs, that's actually stimulation FSH injections. The role of stimulation injections is to stimulate your ovaries and grow your follicles. Let us say at any given time you have probably 15 to 20 small follicles. They're called antral follicles. They're less than 1 centimeter in size. FSH injection makes them grow bigger than 12, 13, 14, 15 millimeters. So approximately we really want follicles to be 15 to 20 millimeters in size for maturation. So that's the role of FSH injection. So in this step I will explain how do you do the FSH injections and how we monitor response to the injection stimulation. First, storage. So in terms of storage, you can store your FSH drugs, injections in three different conditions. One is a long-term storage conditions, which means once you bought the drug, it should be put in the fridge between 2 to 8 degrees. So if you store in the fridge, you can store until it expires. So second storage is short-term storage, which means in the room temperature. If you store the FSH injections in the temperature less than 25 degrees, then or refrigerated, you can store that FSH up to maximum 3 months. And the third storage conditions is very short term, ultra short term, which means once you pierce the ampule, if you loaded that ampule into the pen and start using it, you can store that ampule or pen in the room temperature for up to 28 days and use for treatment. So that's very important to understand storage conditions. Of course, you need to read instructions of the drugs to be really precise. Okay, so in terms of injections, so usually you do these injections every day, every 24 hours. You don't need to worry too much if you're giving injections a little bit, half an hour earlier or later, because these FSH drugs stay in your bloodstream much longer than 24 hours. But during that 24 hours, it maintains the dose you have given. So approximately you do these injections every 24 hours. You usually give these injections during evening times. Why? Because you do blood tests when you're monitoring the response. Depending on your estradiol levels, hormone levels in your scan results, you may need to adjust the dose. Usually you do blood test and scan in the morning, you get the results in the afternoon, then your specialist makes a plan either to keep the dose as it is or reduce the dose or increase the dose, or maybe even stopping the dose towards the end of your stimulation. So this is why usually clinics ask you to do the injections in the evening, but some clinics may ask to do mornings. As you can see from this chart, your ovaries have a lot of small follicles, and the role of FSH is to grow these follicles. So naturally you produce one large follicle and ovulate one follicle, but in IVF we want to produce 10-15 follicles. For that we need to give you higher dose of FSH than your natural FSH, and we need to maintain it long enough to achieve this goal of collecting 10-15 eggs. How long? It's approximately 8 to 10 days. So the duration of the FSH injection can vary. So in some patients you need to give a longer injection, so which means you need to monitor more frequently, longer, until follicles are mature. In some patients you just need to give 7 to 8 days, and that's sufficient. It's not less than 7 days. So okay, so once you give these injections, as we said, every 24 hours. So then once you're giving FSH injections, you need to monitor how your ovary is responding to FSH. Normally you don't need to monitor first 5-6 days, because it takes time for the FSH dose to build up in your blood and then your ovaries to respond. So you can generally start monitoring from day 6, day 7. There's a difference between clinicians in terms of starting first monitoring. So let us say you did a scan and blood test for monitoring from day 7, for example. So on ultrasound scan, you measure each and every small follicle you have on your ovaries and count. You tell how many follicles you have on the right ovary in size of each follicle, how many follicles you have on the left ovary in size of each follicle. So that tells us how your ovaries responding to the FSH injection you are taking. Then you do blood test, which includes estradiol levels, to check how you are responding. Higher the estradiol is, the better the response. And we check LH levels to make sure that you're not surging, which means your down regulation with antagonist is working. And also progesterone levels, again, to check you haven't surged, you haven't started ovulating. So usually you need to do a couple of blood tests and scans, and these are done in alternate days. So let us say you did the scan and blood test on Monday, continue FSH injections, then blood test and scan on Wednesday, for example. So yeah, depending on the size of the follicles and the level of estradiol levels and all the hormones, then clinicians decide, specialists decides whether you are ready for the trigger, for maturation trigger. So before that, you need to start antagonist injections to down regulate. So antagonist orgalutran or tetratide, these are injections to block your pituitary. Usually you start from day 5, day 6, and then continue antagonist injection until the day of trigger, and continue normal FSH injection until the day of trigger unless it's required to stop or reduce the dose. Then you do the trigger shot. After the trigger, then after 2 days you do a collection. So there's very practical advice in terms of getting your FSH injections right. First, you need to put your alarm on. Let us say if you're doing injection 6 p.m. every evening, you need to put your alarm on so that you will be reminded of the injection. So second is every time before you're doing injection, you need to read the written instruction sent to you by the clinic. You need to double check the name of the injection, so dose of the injection and time. So then you take the pen, load the ampule, then dial exact dose required on your instruction. So then you give this injection under the skin. So essentially the injection is not painful because you do it around the belly button where you have the least amount of nerve endings, pain receptors. And second is these needles are quite fine and they're not painful. So you do the injection and then you need to discard the needle in a safe container, which is provided by pharmacy or your clinic. So that's very important. So yeah, so understanding of FSH injections and storage in instructions on injections in monitoring is very important to get your cycle right, because FSH is one of the most important drugs in IVF. The type and dose of FSH, duration of FSH, and monitoring for response to stimulation to FSH is very critical in terms of getting right amount and quality of eggs for IVF, which is by far the most important factor in determining your success in IVF.